Like other state governors, as a result of the impact of COVID-19, the Sokoto State Governor, Aminu Tambuwal, today signed the 2020 revised budget. This was done minutes before the commencement of the State Executive Council meeting. According to the State Commissioner of Finance, Honorable Abdul Samad Dasuki, initially the 2020 budget was over 200 billion naira, but now it stands at 164 billion naira. He said the change was made as a result of the global economic meltdown occasioned by the outbreak of the virus. He also says the state government has approved tax reliefs and incentives for taxpayers and businesses to cushion the effect of the pandemic on residents. Now we have Dr. Deji Olaleye, a physician from the National Health Service, Essex, United Kingdom. He joins us via Skype. Thank you for joining us.
Thank you for the opportunity, Millicent. How are you doing today?
I'm okay, thank you. I hope you're doing good as well. The UK Prime Minister, the UK Prime Minister says the government didn't understand the virus in the first few weeks and months, and then he acknowledged that there were things the government could have done differently in handling the virus. I guess we can say that it's the same for a lot of leaders across the world, learning about a new virus. But in your estimation, how would you say leaders around the world have done? And this is to, flattening the curve of COVID-19 in their various countries.
I think definitely certain countries performed excellently well. New Zealand, for instance, so far seems to be the benchmark for assessing performance in controlling the effects of the virus itself in terms of spread and manifestation of diseases. I think primarily, if one saw the way New Zealand instituted a lockdown early in the day, I think that if there was anything that stood out in all the nations that performed exceedingly well, it was because of putting forward an early lockdown, instituting an early lockdown. So I think that was one thing that set those countries apart, countries like Singapore as well. So that was one thing that the UK could have done earlier, and I think they recognize now in retrospect that had they instituted an early lockdown, among other things, maybe the effect of the disease wouldn't have been as we've witnessed it here. In addition, I think...
Okay.
Yeah?
Go ahead.
I was about to say that the Prime Minister's recapitulation was significant as we prepare for a second wave of the virus. It was clear that certain mistakes needed to be acknowledged and we needed to prepare to forestall similar occurrence in the future. So I think it was important for him to acknowledge that as well.
So in terms of the trajectory of the virus, we understand that weekly figures published by the UK government say the rate of infection has remained at the same level for another week. Is that progress moving forward or backwards?
Well, in one way, I think it's largely progress, because that tells you that, because in the same way we say that 2 weeks, what we see on the field is the effect of measures that were in place 2 weeks earlier. So it tells you that one way the R numbers, which is the rate at which new people are being infected or rate at which disease being transmitted, are kept low, and that we can continue in our present measures to curtail the virus. So I think it's a good thing. It is still progress. And in any case, it will take another 2 weeks for us to know how well we're doing from what we are doing today. So,
if you could, in a minute, tell us about what you've observed from Nigeria's response to the virus.
Well, I think it was difficult for Nigeria. Nigeria is challenged by a health system that couldn't have been worse prepared. The lack of infrastructure, not just the health system in general, so many things mitigate against preparing, against mounting an effective defense or an effective response to the virus. So there was really no way. I think the odds were stacked against us. Within the resources available to the NCDC, I think at the beginning they had just access to 20,000 test kits. There were limited isolation isolation spaces if you account for the number of people in the country. In addition, even when people fell ill and required organ support, the number of ventilators available in the country were really low. So the odds were really stacked against us. And in spite of all that, probably a few things could still have been done better. I would say that the lockdown in Nigeria could definitely have been instituted earlier, as that was the only measure that could really protect Nigerians from the virus. It was us closing down the borders. And a few countries in similar position to Nigeria in terms of our economic status were able to do that and still achieve the good outcome. So I think Nigeria still has a lot to think about going forward,
All right.
especially in the challenges facing the health system and possibly the whole nation at large.
We'd like to thank you, Dr. Deji Olale, a physician from the NHS in the United Kingdom. Thank you for joining us.
Thank you.